talk about avoidant and restrictive food intake disorder, otherwise known as ARFID. That's what you'll probably hear it called most commonly. And ARFID is what it sounds like. So avoidant and restrictive food intake. So that means that people are restricting their intake due to typically like some sensory aspect of the food or some fear about eating. The difference with ARFID and other eating disorders that you might be familiar with as well, like anorexia nervosa or bulimia nervosa, is that ARFID doesn't involve concerns about weight and shape. It's really about the process of eating. So maybe that could be fears of vomiting or choking on food or having some other negative experience. Or it's due to some sensory aspect, maybe the way that a food or whole groups of food taste, look, the color of the food, the smells of the food, or some other kind of sensory aspect of that. And in order to be diagnosed with ARFID, it has to lead to significant weight loss, or in children, like a failure to grow as expected. It also can lead to nutritional deficiencies, different vitamins that you're not getting enough of. It can result in like a dependence on supplements. That could either be through tube feedings or like supplemental foods like Boost or some other supplement. So the person is like avoiding real food and eating real food. And or it can lead to impairment in social functioning. And so in order to receive a diagnosis of ARFID, that avoidance of food has to lead to at least one of those consequences. And when I mention impairment in social functioning, that could be like difficulty eating food with your family or in typical social situations. And so maybe someone might come to avoid eating out with friends or eating family meals, and it's leading to problems within their relationships because of that. And again, I mentioned like the restriction is not related to fears about like weight or shape or trying to control weight or shape. ARFID also has been likened to like picky eating. And so it kind of seems like that. And especially in children, people might say like, is my child really a picky eater, or is this ARFID? Is this something that's diagnosable and needs help? And really what the difference is there is the severity and the persistence of it. So with ARFID, and to get a diagnosis of that, really has to be like severe enough to be causing impairment and dysfunction. And so you're noticing like what I mentioned with the weight loss, significant weight loss, failure to grow as expected, nutritional deficiencies, ways that this is really actually impacting health and well-being as well as functioning. So like I mentioned with the social functioning. We see ARFID in children and adults. It's most commonly seen first in children. So we see that happening earlier on in life. But adults can develop ARFID as well. And so we really see it across the lifespan. Some things that might make someone might ask, like, what are risk factors for ARFID and who develops this? And some things that we see commonly are like folks who already have some challenges with sensory aspects of things. So you might see that in autism spectrum disorder. So we do see ARFID co-occurring with autism spectrum disorder commonly. Other anxiety disorders. So if someone already has an anxiety disorder, they may be more likely to be more susceptible to ARFID and to be more susceptible to fears around food or fears of choking, fears of vomiting, fears of other kind of negative interactions with food. The hopeful part about ARFID is that it is very treatable. We have treatments that work. Most commonly, the treatments that you'll see are cognitive behavior therapy, exposure therapy. So exposure therapy is kind of our bread and butter here. This is the gradual exposure to a feared situation or thing. So in this case with ARFID, it would be gradually exposing to the foods that have been avoided. And we can do that. We do that in a really specific way with ARFID, where we're kind of taking it bite by bite and step by step to slowly be around that food more, smell that food if that's the thing that might be getting in the way for someone, tasting the food in small portions and then gradually expanding that so that we can increase diversity of food intake. Nutritional counseling is also really common. There's medications that can support. And so we have a lot of different treatments that can be helpful with treating ARFID. And it's something that you can definitely find in the community and something that we can help with here.